Ladies and gentlemen, dear colleagues, dear friends, a very warm welcome on the second edition of the Generic Medicines Day. As you know, generic medicines have a unique role in making medicines accessible. They break through the monopolies of originator medicine, so they bring competition on the market. They drive prices down, and this ultimately to the benefit of the patient and the healthcare system. And really, this is something that we at Medaxes, we are really very proud of. To give you one example, one figure just to illustrate this, for instance, we have been calculating that generic medicines only for this year, they saved to the needy system 1.9 billion euros. Imagine yourself, just 1 minute, what would happen if those 1.9 billion euros were not there for the healthcare system or for the patient. Now, of course, needless to say that the last 2 years for all of us have been overshadowed by the COVID crisis, by the pandemic. And this pandemic has brought, again, medicines into the center, the core of the societal debate. At many occasions for the good, but also from a more critical side. And the same goes for off-patent medicines. On the one hand, it's really a matter of fact that up to 90% of the medicines that are currently used to treat COVID patients that are hospitalized, those medicines are off-patent medicines. And even though we have seen for some of those off-patent medicines a surge in the demand by more than 900%, thanks to the resilience of our sectors, and thanks, of course, thanks to the relentless effort of numerous healthcare professionals, we were able to help to support these patients. But on the other hand, by the same token, it is also a matter of fact that despite the fact that no patient in our country has been left behind, it is a matter of fact that the COVID crisis has demonstrated also the weak spots, the weak points in our supply chain. And this brings me to the subject of today's webinar. What can we do by drawing lessons on this recent past? What can we do to build even a better future where generic medicines can continue to play this unique role in making medicines affordable? Now, of course, this is a topic with multiple dimensions on a national level as well as on an international level. For instance, at the national level, we see on the one hand the federal government's manifesto recommending doctors to prescribe more cheap medicines, whilst on the other hand, we see in practice that unfortunately last year 1 out of 5 generic medicines disappeared from the Belgian market, and this is very worrisome. Now, in this challenging context, I'm really happy that today I can welcome very distinguished speakers coming from a very diverse horizon. Now, to start the debate, I'd like to start at the beginning of our pharmaceutical supply chain, being the production of active pharmaceutical ingredients. So I'm really impatient now to pass the word to Dr. Andreas Meisser. Dr. Meisser is the partner and CEO of Mundicare. Mundicare is a strategic healthcare consultant. And Dr. Meisser and his team have conducted a survey on the geographical origin of APIs. This study, by the way, has been commissioned by our German sister association, ProGenerica. Dr. Meisser, the word and the floor is yours.
Good morning. Thank you for the invitation. This morning I would like to share the results of our studies. Where do our active pharmaceutical ingredients come from? a world map of API production. This study was executed by Mandicare in collaboration with ProGenerica. What did we want to achieve with the study? First of all, we wanted to get a fact-based transparency. Where does the European supply of active pharmaceutical ingredients come from? Secondly, we wanted to understand the recent developments and their root causes. And finally, we also wanted to give a few ideas how we want to go forward. What can Europe do to secure the supply of important, life-saving, active pharmaceutical ingredients? As we have just a limited amount of time, let me directly jump to the key findings of the studies. First of all, I think the most important is the supply of Europe's active pharmaceutical ingredients faces some serious risks. If you look on the SEPs, a SEP is mainly an approval and certificate that you are allowed to supply an API to Europe. 2/3 of these SEPs are currently held by Asian manufacturers. They are not produced in Europe. If you look a step further down on a more granular level, you see even if you look to India and China, these production sites are not evenly distributed over the countries. They are really concentrated in a few regions and cities. If you then have a look on the portfolios of APIs, 1/6 of the APIs which we examined in the studies don't have any production site at all. And for more of 50% of the APIs, we have a very limited number of suppliers, between 1 and 5 only suppliers, which poses another risk. If we look a little bit back in history, it has not always been like this. Europe used to be a very strong producer of active pharmaceutical ingredients. Actually, it was a leading position. It was a leading API producer. But if we look back for the last 20 years, Asia significantly outperformed Europe. It was not that Europe went down, it was that Asia grew much, much faster than the European businesses. Just to give you a little bit of a background, so in Asia, the number of SEPs increased from 180 to more than 2,000. In the same time, the European manufacturers could grow their SEPs only from 350 to a bit more than 1,000. When we look at what are the root causes, what are the reasons, why did we see this development over the last 20 years? On the one hand, it's an uneven playing field. We have different regulatory standards in Asia and in Europe. The main factor is also the cost pressure for European final end producers. And last but not least, it's also slow administrative processes in Europe. If we look, what do we have left in Europe today? So there is still production, but it's really, would say, these are niche productions. They are specific APIs. They're APIs which are difficult to make production. But still in Europe, we still have the technical know-how, and we also would have the capacities to increase the API production if we want to. Let me now give a few examples of the study. So there is a full version available on the ProGenerica website, but let me have a look on the few selected slides. Now let's have a look. What is today the distribution of SEPs, these certificates for production? You see the roughly 4,000 of these SEPs, and 1/3 are held by European producers, and 2/3 of them are held by Asian producers. Let's say by far the most important are Indian producers, and then it's China. And all other regions of the world play only a minor role, like North America or Latin. So you see a very strong dependency of European API supply on India and China. As I already mentioned, it's not only India and China, it's even much more focused, it's more concentrated. If you look on the provinces, so we really did a detailed analysis and see where are these production sites located really on a city basis. So you see, as well as in India as in China, it's only concentrated in a couple of provinces in both countries. So this means in cases of an COVID-19 of a natural disaster, we are very dependent on these few provinces. If the supply is cut of these provinces, we will face a supply issue very, very soon. I would like to not to show where we stand today, also how has it developed over the last 20 years. Let's have a look back in the year 2000. You see the blue one, Europe, almost 30%, almost 60% of the SEP of the approvals are held by European manufacturers, and only a third is coming from Asia. If you see then over the time, this ratio has completely flipped. Today, Asian is the dominant producer. And what you also see, it's not that the European production has shrunk. It's just Asia grew much faster than European producers could do. If you also ask the stakeholders in the industry, why has it come to this? What was the root cause of this development? First of all, what you hear is a high price pressure for generic APIs. So as long as there is a pressure for cheap components, people look what can they get out of Asia. Then when you talk to people, if they are interested to set up European production sites, the approval processes are so difficult, are so complex, it takes so much time. It's much easier and much faster to build a site in Asia than going through the cumbersome processes in Europe. Finally, it's also like customers don't want to pay for supply security, for quality standards, for environmental standards. All of this has caused to this development over the last years. When I was looking now over the overall development, let's also have a look of the product life cycle. What you see now on the 3 rows is the share of Asian production for certain APIs. In the first row, you see the APIs which get the first SEP before 2000. In the second row, in the middle row, you said who got the first SEP between 2000 and 2009. And then in the last row, you see all which got the first SEP after 2010. In the shade of green, you see, the darker the green is, the more of the production or the more of the SEP is coming out of Asia. You see all the APIs which got their first SEP approval before 2000, you see it was very light green. It means very little production in Asia, very little approvals from Asia. And you see over this 10-year horizon, if you go from the left to the right, you see slowly the share of Asian producers increased and more Asian production sites came online. If you now look on the row at the bottom, you see between all the APIs which got the first SEP approval after 2010, you see already from the start, even in the first year, which is the left box at the bottom, you see there's already at the start, there is a high share of Asian producers. So as soon as the component loses the patent, already Asian producers are already there and are already ready to produce this API. To summarize what we have seen in the world map, you see in blue Europe and green Asia. You see on the one hand in the small little graphs, you see the increase of SEPs in Europe and various Asian countries. I think it just shows again what I have said. In Europe, you see the number of SEPs increased over the last 20 years by a factor of 3 and 4. If you look on all European countries, it's pretty much the same. So the ranking between Europe did not change a lot. If you there compare it to Asian countries, so the number of SEPs increased by 13, India 16-fold, China even by 22-fold. And that's not only true for the SEPs. You see in the small little rows below, you see the same is true in the number of APIs and also in the number of manufacturing sites. Let me come to the end and say, what is left today? So I said, let's say there is already quite a lot of production is gone today. If you try to give it a different twist and see what it's still left. So we could also say there is still 33%, there is a third still left in Europe. And these are complex APIs which are difficult to make. This is for some customers who really want to pay for supply security, for environmental safety. So they're even willing to pay a premium for European production. And what we have heard through all the interviews with production side and stakeholders, so there is still capacity left in Europe, and there's also the know-how. So still, let's say, I think we can slow down, that the production moves to Asia. I think that's the minimum what we could do. And to some extent, it's also we can encourage European producers to do more production here. Would like to give you at the end one example. It's the site in Kundl from a Novartis side. And this is the only the last remaining fully integrated antibiotic site in the Western world. And there is an agreement between Novartis and Austrian government. They formed a partnership to keep this production site in Kundl, to keep it state of the art, and so they did a joint investment. So I think just want to give this as a starter of discussion, say there is something what we could do, something what we could change to keep the API production in Europe and to secure the supply of APIs for European patients.
Good afternoon, ladies and gentlemen. I'm very sorry that I'm not able to be with you today physically, but at least I'm with you virtually, which is a new world in which we are living now. I know that the event you organize is a very important one, and it's something which is completely in line with what the Commission wants to do at this level with respect to granting patients in Europe the possibility to get to affordable medicines everywhere for all our citizens. And we believe this is something which is extremely important. As you know, a few months ago, the Commission proposed its pharmaceutical strategy, which really looked how we could create and shape the future of our industry in Europe to make sure actually that all citizens are well treated and well protected with respect to health. And we know that health is something which is fundamental. Health is an issue which we cannot ignore. And unfortunately, the COVID crisis has taught us that it was a reality we have to take into account. So what are we going to do with the pharmaceutical strategy? As I told you, we have launched a process of dialogue with industry. All participants of the industry should be there, but also we have a dialogue with the patients, because we should not forget that we need to take into account the dimension of the citizens, of everybody which is out there. So we have launched this dialogue, and we have continued to work with all stakeholders to make sure that we are able to make a proposal next year, at the end of next year, to review the current legislation on pharmaceutical products. Now, as I know, the generic industry is a very important player also in this context, because you are able to provide affordable products to all our citizens in Europe. And we believe this is a very important element, of course, because as I said, affordability will be a very important question for us. The second dimension, which will be extremely important for us, is the question of innovation. We need to make sure that we continue innovating in Europe. Because without innovation, we know one thing for sure, that in the future we will be simply lagging behind the rest of the world. And we cannot accept this for our citizens. So we need to continue to be innovative. We need to continue to be in the lead. And again, if I can make the link with the COVID crisis, let's not forget that some of the vaccines and the most innovative vaccines which are now being spread around the world have been invented, have been created in Europe. So we should be proud of this, what we have done, all of us together. Now, third aspect, which I believe is extremely important of our revision of the pharmaceutical legislation, is the question of resilience. We need to create more resilience in Europe. We need to make sure that actually our citizens will get access to the medicines they need, and they will not be necessarily too much dependent from the rest of the world. But also, let's be clear, we don't want to create Fortress Europe. That's not the message. We don't want to close the borders. We need to be realistic. What we want is what we call an open strategic autonomy. So we are open, but also we need to have some kind of autonomy. How do we achieve this? I don't have a magic solution now. It's something that we want to continue to talk with you, with all stakeholders, to find the appropriate solution, the appropriate balance. Now, coming back to you and your sector you represent. It's a very important sector in Europe. You play a very important part, and as citizens, all of us are actually confronted with your products, and that's very good because you are part of this industry, and you are part of this industry by promoting also innovation, competition, and affordability, which is very important. So I'm very pleased that you organize these days today. It's a very important element. I know that some of my colleagues will be present, will be there with you, will be listening to the different speeches. And the message I would simply just to convey to you as a conclusion is let's work together. Let's try to learn the lesson for the COVID crisis. Let's work together to build a better environment for our pharmaceutical industry in Europe and also to the benefit of our citizens, because we should never forget the end game is a citizen. It's you and me as normal person. Thank you very much, ladies and gentlemen. I wish you an excellent day, and I'm sure that the debate will be extremely interesting. A lot of very important news and information will be given to all of us, and I look forward to looking at the result of your day. I wish you all the best.
Hello everyone, and welcome to this panel discussion. Let me first thank Mr. Delceau and Mr. Meiser for their kind introductions, and the themes of this panel discussion have been set by them already, and also in the introduction by Mr. Van Asse. Europe is reviewing its pharmaceutical strategy and is putting a lot of emphasis on the production of medicines in Europe and the resilience of the supply chain, but also addressing access to medicines, affordable medicines. Next to that, also we see in the Belgian government agreement that a lot of attention is being paid towards more use of cheap medicines and also a more robust supply chain for medicines, as the pandemic has learned the last 2 years how it goes. And it came with some hiccups also in Belgium to have enough supply of medicines. We were successful to do so, but it came with some hiccups. So let's talk about that today. Let me first introduce you to our honorable panelists. First of all, we're very pleased to welcome Ms. Olga Solomon. She's head of unit medicines within DG Santé at the European Commission. We also welcome Mr. Brieux van Damme, who is Director Healthcare at NIGDI RISIF INAMI, nice words in the abbreviations, the Belgian administration for reimbursing of medicines. And we also welcome as well, last but not least, Joris van Asse, who is the Managing Director of Medaxes. And we're also joined by Dr. Meiser as well in a virtual way, who will go deeper into his results of the study on the origin of APIs. So, as Mr. Delceau and Dr. Meiser already broached two major insights on the European strategy and the medicines production, we'll try to trigger this debate with some topics, with some statements supported by graphs and data. So let's have the debate and let's start it. I have a first slide with the major question: how can we increase the use of generic medicines to maintain an accessible healthcare? As shown in the graph, you can see in Belgium that especially in hospitals, the use of generic medicines is quite low. If we compare it to other European countries, we are by far the lowest, the last in class in the use of generic medicines in hospitals. Also, generic medicines in retail represent some 38% of all medicines in the open officine and the public pharmacies. So my first question would be, Ms. Solomon, if you see these figures, what can Europe do to support countries to improve this access?
Mm-hmm. Yeah, no, thank you very much, and actually thank you for having me today. Indeed, the issue of access, to medicines, and especially, of generic medicines into the system, it has an influence on both access for patients, but also for the health system sustainability. However, I would like to start, as you introduced, we are building a full pharmaceutical strategy we're implementing right now with the aim to focus on access for patients operations and sustainability of the health systems, but I have to start by saying that, there are issues that they can be, handled with legislative changes, some others that they are national competence. And here, we are really into an area where, member states, they define their, health policies, pricing and reimbursement intake, uptake of generic medicines. However, as part of the pharmaceutical strategy, we will do a lot, and probably we will have the opportunity to discuss more about in detail. But, coming back to your point on the uptake of the generics, even if it is not an EU competence, what the EU stands by it is to coordinate member states, to facilitate, discussions and coordinated approach and exchange of best practices. And there are already structures that, we are working, with member states, because there is definitely a lot that can be improved and learning from each other. And in the Commission, we work, for example, with a group of national payers, in order to actually delve into issues, of uptake of generics, how we can improve, also more transparency about pricing, procurement, etc.
Okay, thank you. Mr. Van Damme, I pass the word to you. From a Belgian administration perspective, how do you build upon these ideas being coordinated by Europe? Or we are all waiting for a new pact with the pharmaceutical industry. How do you see some ideas to build on that?
Well, thank you for having me as well, Mr. Baudry. Indeed, we're the payer in Belgium, and as a payer, we are technology neutral or origin neutral. What we want to see is a sort of healthy market dynamic, where in the patient's interest, but also, of course, in the interest of social security and a sustainable healthcare system, we see that the off-patent market is dynamic enough in order to free up means to reimburse innovation in a sustainable way. So I don't think the objective of the payer can be to increase the market share of one technology versus the other, but more to assure a long-term strategy. Both to have sufficient access and supply of very important medicines, and indeed I think the pandemic has shown that a strategic reflection on how we're going to organize and position ourselves as member states, but definitely as a continent as well, is going to be key. So I'm not saying that this is a irrelevant debate. I'm only saying, as a payer, where the drugs come from is of lesser importance maybe. But as a continent, as a country, obviously this is a very strategic discussion, and as I think Mr. Meiser has shown, requires a true debate, which is of course of a political issue at first hand. And involves many different parameters. Cost is one aspect, of course. Dependency is another one. Industrial policy could be a third one. And all these things need to looked at together. But as far as the National Institute for Health and Disability Insurance is concerned, we want to assure a sustainable access both to off-patent medicines, but also to innovation. So we try to be as technology neutral as possible.
Okay, thank you. We'll come back later to the topic of production and independence or dependence. Mr. Van Asse, given the specific Belgian market situation and these figures, do you have something to add to that?
Yes, maybe just to elaborate on what Mr. Van Damme has said. I know that the Belgian authorities, this is historically, always has been like this, that says, okay, we have a neutral role. Generics as such is for us not an objective, it's more an objective of cheap medicines, indeed, in the off-patent segment. Although I want to say that I understand this from a policy perspective, an overall policy perspective from the Belgian authorities, but definitely generics have a specific role to play, and we need sufficient space for generics. Because generics in the off-patent segments, it are the generics and the biosimilars for biologicals, only the generics that trigger the competition. Yeah. So there always must be a sufficient space for generics. Now, having said that, if you look to the proposals of Medaxes, we build also on proposals regarding cheap medicine. So we don't make, for some elements, we don't make that difference, not even on our side. So, and indeed, there is still room for progress. We cannot deny that, and we need off-patent medicines. We need off-patent medicines to keep the budget under control. Finally, also to create headroom for innovation. Maybe off-patents will not be able to create all the headroom for innovation anymore, but we definitely need them. Now, coming back on measures we can take to increase the volume of patent cheap medicines, there's still a lot of things to do. I think the first and almost is the targets for cheap prescribing. They were revised 3 years ago, already 3 years ago, so that's a long period of time. Nowadays, I think it's really very difficult to explain that for some medical professions, like for instance dermatologists, neurologists, etc., this target cheap prescribing is still at 0%. That's something that definitely needs urgently to be revised. Also, we believe that, and also in line with the government's manifesto, who is clearly recommending doctors to do more about cheap prescribing. For instance, we could nudge, or why not incentivize doctors to start a chronic treatment with a cheap off-patent medicines. Of course, unless there is a medical contraindication. When it comes to hospitals, whether it are generics of cheap off-patents, we all know that in hospitals it's a complex situation. I think typically in Belgium we need urgently to review the tender legislation so that at least the tenders in hospitals can be reopened more in a timely manner. Also, and this is typically for generics, when we are talking about legal provisions, we need, for some categories of generics, we need special legal provisions. And one that is very important and which is currently, I would say, a hot topic, is the question of generics in the pipeline for medicines, brand medicines, originator medicines that are currently the subject of managed entry agreements. That's a big issue, problem where we urgently need a legal framework that can organize this. So this is a couple of measures I think we need, whether it are generic medicines or cheap off-patent medicines, where we urgently need to have some, let's say, some support.
Okay, thank you. That's a long series of already actions that we can take. Mr. Van Damme, you wanted to react briefly? No, absolutely. So I'm very happy with what Mr. Van Asse is proposing, because indeed the suggestions you make and the recommendations you make are technology neutral. I think indeed the quota for cheap medicines that we ask physicians to follow could be updated, but that won't be enough. What we will have to do is also incentivize the doctors in a constructive way to reach those targets. And I think there are a couple of levers that we can use that are underutilized today. Accreditation. I'm sorry if I'm making this debate a little bit too Belgo-Belgian, but the accreditation could be a lever indeed to nudge, as you suggested, physicians to indeed reach those quotas of cheap medicine. Second suggestion Mr. Van Asse made was the tender legislation, and indeed, and you are well aware of that, there is a proposal on the table, I think, and I hope it's going to reach Parliament soon. And indeed, if we change that law, I think again we can make that market in the hospitals, and especially for the huge chunk of biologicals that are going to lose their patent in the next years to come, we can use that to dynamize the market. And I really hope there will be a political majority to change that legislation. Okay. I'll pass the word to Dr. Meiser with a very specific question. Do you think, or did you see in your study, that a low volume of generics is a factor for production investments in specific countries? This is a very specific question.
Okay, thank you for the question. Thank you for having me here. Coming to your question, I think the situation is a bit more complex. Just because if you say you're moving from originator to generics, you don't increase the market size at all, right? You just take it away from originator and you give some additional volume to generics. So the question is, where is the supply today produced for originator and where is it coming future from the generics? So in itself, right, it does not increase the market, it does not increase the production, it just might change, it might shift the production and all the sides. If you see, I think what we have heard, the key reasons for it is cheap, sustainable medicine for the patient. You see quite often if you go from originator, you go to generics, you increase price competition. Then you see if you have this price competition, one of the factors which has driven the API production to Asia was in fact this price competition. So actually I see if you move from originator to generics, so there is the risk that you enforce the current developments to have a stronger Asian production. I don't say this must happen. I think it's also just to set the right boundaries, right? If you want to have, I see the reason to go from originator to go to generics, and sometimes to increase the competition to have the cost competitive medicines available. But I think then it's also a question to set the supply chain rules, to write the policies, the right regulations, that you don't force further production to Asia. And I think price cannot be everything, right? It cannot be just cost. The factor should be not for me only cheap. It should also be, it must be cost competitive, it must be available, it must be sustainable, but it needs to be reliable, right? We need to put much more emphasis on the resilient supply chain and say, okay, we must be willing to pay more to have supply security. We must be willing to pay more to attend to certain environmental, ecological, economic standards, right? To say, but I think that's a question for regulation and politics to set the right framework.
Okay, thank you. That perfectly transfers the topic to my second statement, and this is a graph being developed by Medaxes, where you can see that the last 10 years, the price erosion, as Dr. Meiser pointed out as well, has gone quite fast. The price per pill is being portrayed on the presentation. And the question that goes along with it is also already in the introduction by Mr. Van Asse pointed out, is that 1 out of 5 generic medicines has left the market, is no longer on the Belgian market, due mainly to the price erosion. Mr. Van Asse, how do you look at this price erosion?
Yes, it's a matter of fact. I think what's worrisome here is the core of the generic business model. I mean the following. In the generic business model, we see what we need is an equilibrium between price and volume. And of course, I can only talk here about the Belgian situation. And what we see with the volume, we've seen that in the previous slide, the volume is limited. And we look to the price, we also see this price erosion. And what we definitely need here now, apart from the measures to increase the volume I just explained, is with regard to the price, look what happened over the last 14 months. We had 3 consecutive price decreases with an impact of more than 8%. On top of that, we have a monthly review of the price list, we have quarterly review of the price list, and that's way too much. And the first thing I would advocate here as a representative of the sector is, please give us a bit of simplification, give us a bit of stability, give us a bit of predictability. Linked to that, and again, this is very Belgo-Belge, but indeed very important, there is the discussion on the clawback, where, if I'm well informed, paying clawback taxes, Belgium is when it comes to generics or the eligibility of generics for clawback, it's rather exceptional compared to other countries. Fortunately, last year we got for 1 year an exemption in the law for paying the clawback. So what we are asking, in the light of this stability and predictability, is that for the years to come, once and forever, I would say, this would be finally enshrined in the law for the years to come, that there is an exemption of the clawback, which would align us to what is the case in most of the other European countries.
We'll come to Europe in a minute, but maybe first, Mr. Van Damme, do we need a kind of a safety net for guaranteeing access to medicines, that medicines are available over the years?
Absolutely. So I actually agree with what Mr. Van Asse is saying. Supply is key for public health, for treatment continuity. So it's definitely a factor to take into account. And I think today's legislation indeed has a couple of exemptions that can be called upon if indeed the supply of some molecules is in jeopardy. So we can definitely look at how to reinforce that and potentially make the procedure more simple, more efficient, and more easy to call upon. Second point, the simplification advocated by Mr. Van Asse, I fully agree. There are, a couple of measures that were taken over the last 10 years that I think were made a lot of sense to, as I tried to say in the previous point, make the market dynamic and ensure that sustainable access to both old and new drugs. However, now we see a maze of measures that make it very difficult both for companies and for the administrations to follow up upon. So I think there's definitely a case to be made, and I would be the first one to defend it, to simplify the system without throwing all the principles on which it is based overboard. And indeed, hopefully in the next coming months, we will come to an agreement as to how to do that. And indeed, last point, predictability is key. The minister is working on a pharmaceutical pact that should give that predictability and that financial assurance. I am confident we will find an agreement soon.
Thank you. Combining what Dr. Meiser already said, like, okay, the regulation is too heavy, it's too administrative, and this leads to the going away of the medicines in Europe, combined with the pricing policies and so on. How is Europe looking at that?
Mm-hmm. No, thank you. And actually, it is very interesting to follow the debate, in Belgium, because, from Europe also, we get the same everywhere we go. We see the same or similar debates, in all member states. So there are a lot of commonalities as well. And for me, what it is impressive, from this discussion, it is also how important is all the life cycle, of the product. The European regulation, as regulator for authorization of medicine, protection, and incentives for innovators, how they influence the entry of generics, etc. And then the national policies that they come hand to hand. So what are we doing, in Europe? I would actually use the words of Mr. Van Damme that, also, the new pharmaceutical strategy, it is also technology neutral, So, and we see that, in terms of access and availability, we have problem right now, both, with originators, and with medicines, with off-patent medicines. So we need to find solutions, in all ways, and this, of course, it is a very big challenge, but, we do have, some, ideas how to go forward, for example, on one hand, to encourage innovation, and especially innovation for unmet medical needs, listening also, not only market-driven, but also, health system, patient, driven innovation. So we're looking into, this direction. In terms of, supply, we heard, very interesting comments, as you said, about the supply. It is solutions, how to secure the supply, and I think we will discuss this more, but also how to secure access, more equity, in Europe, more access, So, and in that sense, I think in the off-patent and generic industry, it is a key player, in this for all the reasons that you mentioned. They give more affordability, etc. So on one hand, we are looking into a holistic way of the system. I think that in terms of simplification that you mentioned, it is one also of the key elements. How can we simplify the regulatory system so that the entry of generic can come earlier? I mean, obviously, patent issues, we have to respect, but again, simplification of procedures, for example, how can we not repeat assessments, for different products and, go faster, how to ensure also, more smaller member states coming, have availability, because it is not the same in all member states. So it is certain elements that we are looking to review in the legislation. We are evaluating what it is wrong, and with supply and shortages is also, of course, another element that we are looking at with a lot of attention. We have studies, etc. And just the last point, I'm sorry to take too much time on the procurement and all the national, because, as I said before, it is impressive how commonalities there are. So we think that, by coordinated actions at European level, there is also, member states can get ideas or develop together, methodologies, to improve the situation, in its member states. So that's what we are doing in a nutshell.
Well, there could be a benchmark in a couple of weeks, if I understand it well, Mr. Van Damme, with the tender legislation being tabled maybe in the Belgian parliament. So maybe this can be of a proposition for Europe as well to dive into. We've talked about Belgium, we've talked about Europe right now. Let's see it on a larger scale. And maybe that's a very straightforward question for Dr. Meiser at this point. You clearly pointed out that 2/3 of the APIs are being produced in Asia. Do you think Belgium and further Europe has to invest in the production of APIs, or is this a bad idea?
Okay, I think we have to have, we need to tackle this question in several levers. I think on the one hand, we have seen API production has gone to Asia. I think first and most important for me is how can we stop this trend, right? We have seen there was a very high dynamic process in the years of 2010. Now it has already slowed down. I think we need to stop it. I think to some extent we can also bring some of the APIs back, but overall I think we need to acknowledge most of it, what is gone, it's gone. I think it's not realistic to bring everything back. And especially, it's not the API, right? If you just look on the API, the next question is where come all the intermediates from? And then I would even argue even more of this 2/3 are coming out of Asia, so, right? I think it does not really make sense to be too focused and too focused to bring back what is. Slow it down, whatever we can bring back some percentage, which is definitely what we can do, we should do. And I think which is even more important is now have a look on the next wave, right? We have seen these as the generics. These are usually relative simple chemical molecules. Now the next wave is biosimilars. For me, the question is, how can we prevent that we face the same issue with biosimilars, right? Now we had the biological, lots of them going out of patent. We see we have a very strong position in Europe again and in the Western world. Now also we see a lot of Indian and Chinese players coming. Online, they're getting ready. How can we present that exactly the same happens on the biosimilars? And now even if we go a step further to what we see now with COVID-19, we see a new type of medicines based on messenger RNA is coming on board. It would be exactly the same. How can we make sure that we keep this technology? We can keep all the different technologies in Europe, and just that we don't see the same what we have seen for simple chemical molecules, that we see the same trend for more advanced and more complex molecules.
Yeah, thank you. That's a clear appeal towards Europe. How can we secure that this production is being guaranteed here in Europe? As Dr. Meiser has shown in his introductory note, there is still some production in Europe. How is Europe dealing with this item and also in relation with the member states?
Mm-hmm. Yeah, it's no, it is one of the key issues that come up, especially, as indicated, after the experience with the COVID crisis, it is this, what we call open strategic autonomy. It is a key, actually, priority, that occupies a lot of the political and policy debate. But as Dr. Meiser, indicated, it is not like, the final solution. It's, we need to actually, look into the issue and see, what is the best solution, and that's, what we are doing. We are actually looking into the issue whether and to what extent, the manufacturing has to come back to Europe, what are the critical products. So the EU remains very much about also to open and promote open trade as well. So we must, keep the balance between the two. So there is this, but at the same time, with this openness, it is very evident that, we need to do something to secure the supply. And in that respect, a bit, if I go a bit more specifically, with regard to the supply chain, you're probably aware that there's the initiative on structured dialogue that the Commission started in February this year, and with participation from different industry, member states, other stakeholders. And in first phase, we are looking into a bit like what Dr. Meiser, is doing, to look into where are the vulnerabilities of the supply chains, which are our weak points, also how supply chains operate at global level. And, it is work which is done already. So now we're going to the second phase to see, what, we need to do to address, these issues. And this will include probably some legislative parts, but also, some initiatives that are non-legislative, and also they relate also to industrial policy, investments, manufacturing in Europe. Actually identified which products, like Dr. Mezes said, we need to invest, etc. So a lot of discussion, and there will be, action definitely, in the years to come in that respect. Also, from the point of view of shortages coming back, which are related, we have also, a lot is going on with the study, to see again, the link between the different elements and take the right measures. So.
Okay. Mr. Van Damme, is this also a topic on the table of NIGDI? Where do you see solutions, as it's also described in the government's manifesto, to secure the supply chain in a better way today and to guarantee access? Is it a topic on the table?
Absolutely, absolutely. And I like the concept used by the European Commission, coined the open strategic autonomy. I think indeed that's completely the philosophy in which we have to move forward. I think if you look at what the Belgian Health Insurance Institute has done, of course, in close collaboration with the political side, is indeed to try to move the debate forward by taking initiatives together with other member states in order to indeed secure access in the longer term to innovation, and also a strategic approach to having the availability of the drugs that we need. And for example, I think it was mentioned earlier that indeed there is some room for simplification. There are some potential fast tracks that can be implemented. For example, by mutually recognizing each other's health technology assessment reports and whatnot. And this is indeed a debate, I think, that started on member state level, which sort of potentially inspired some European policymakers. And now I think there is a debate about this new regulation, indeed, the European HTA regulation, which potentially will facilitate and improve a quicker access and a better supply of these much needed drugs. So I very much like that iteration between the national level and the European level in order to move this forward. Second point, we've seen indeed the huge value added of Europe taking the lead on some of these debates during COVID, and it would be interesting to try to compute how much welfare actually came from having this joint procurement of these vaccines. I don't know if there's studies going on this subject, but I would be very interested to really show the value added of Europe when all member states agree to move forward in that direction, what Europe can do, and maybe make it more tangible if that has not been done before.
Mr. Van Assen, coming back to this production, how do your members look at this topic? We know there's some vaccines production in Belgium, but there's also production of generic medicines, but it's a worldwide management of the supply of medicines. Yeah. But what do your members prefer, or how do they see at this securing the supply?
Yes, first of all, they, of course, APIs are important, but the point I want to make here is that we should also enlarge the debate to the production of finished products. Yeah? And especially in crisis situations, for instance, like in COVID, the production of sterile products was important. Now, I will not come back on what the previous speakers have been saying. I think indeed this notion of this concept of open strategic autonomy, I think it summarizes it very well. Yeah? It also, of course, implies a lot of challenges. But I would like to make a common sense remark. Of course, this discussion is extremely important. Yeah? What can we do, what should we do on bringing back or not production of APIs, finished products, etc., etc. But finally, this is an important discussion, as I said, but it's a discussion about if I may say so, a consequence, a symptom. Yeah? The root cause, as has been pointed out by Dr. Meise, one of the main root causes is the pricing policy, or are the pricing policies carried out in different member states? And of course, not only in Belgium. It's I think in other countries, like for instance in Germany, you have much more challenging systems even there. But it all starts, as I have been saying already, in the generic context with an equilibrium between price and volume. Yeah? And so when I'm looking to the component of price, if the pricing system is too aggressive, we get a problem.
Mm-hmm. This brings us to my final major topic. We've talked about pricing policies, about supply, production, price erosion, and so on. Do we in fact need more Europe or more country policy when it comes to medicines? For example, the European Parliament end of last month urged for more investments in generic and biosimilar medicines. How do you look at that? I can imagine Europe has maybe a different view than the member states, as health was always attributed to the member states in the first wave. Whereas now with the new pharmaceutical strategy, Europe is pointing out these topics as well. How does Europe look at that? A more coordinated role for Europe?
Yeah. I wouldn't say that we see it in a different way. I think that we see it in a very similar way together with the member states. I think that what it was mentioned before, I think it is the demonstration of the success when Europe works together. The example of the vaccines, the fast development, the early authorization, the availability of the vaccines all over Europe to citizens at the same time, it was unique. I think it was, such a big success of Europe that we do not take the time actually, to congratulate ourselves for this big achievement. And that was the Europe together, the institution together with the member states. So I would say that it's not a matter of having more Europe. It is a matter of having what I said, optimizing what we have in terms of regulation and where we have harmonization, and collaborating more on issues which are and they will stay national policies, but where we can work together to improve. And as I said before, it is more and more evident, something that it was not in the past so clear, that there is connection between these policies. We cannot, for example, regulate in Europe, without taking, the account of the situation of the national policies. There is, more need for convergence, more need for dialogue between regulators, HTA bodies, public payers, so across the life cycle, to improve the understanding and whatever, measures are taken either at European level or at national level, and also across policies, across health policies, industrial policies, that they are actually, coherent and, they make sense, so to improve the whole situation. Is that easy? No, it's not. But, it's, what we are aiming actually, with, well-defined pharmaceutical policy, not to rush, but to evaluate what we have, see where are the gaps, and, build on that to optimize the system. Coming back to your question, if we need more, we need, better, I would say, and we're working on that.
Thank you, Mr. Van Damme. We know Belgium is playing a leading role already in collaboration in negotiating managed entry agreements on a European scale. Do you see other options also for the off-patent industry?
Absolutely. So I completely agree with what has been said. There's momentum now. Before, the pandemic was a black swan, a completely unexpected event that made clear to many people that it's not only about price. It's also about dependency, it's about industrial policy, it's about how do we position ourselves strategically, in this multipolar world where, many different continents try to, of course, defend their interests at best. And so there is momentum now to have this debate. There are several, I think, interesting options on the table. I've mentioned the HTA legislation or regulation that is in the making. There is HERA, of course, that will also facilitate a strategic discussion, which I don't think we've ever had altogether on this specific topic. And then, of course, there is, as has been mentioned before as well, the great success of the vaccine policy, COVID-19 vaccine, of course, which I think should, gave us some interesting lessons as well that we should build upon. And you know that Belgium will have the presidency of the European Council in 2024, and I believe we will indeed try to drive this agenda further as we have been doing for the last 2 decades.
Mr. Van Asse, more Belgium, more Europe, or is this too much of a hard choice? You have the experience within the first wave of the pandemic on the European scale, the joint procurement of medicines to cure COVID-19. What's your experience there from your member side?
Yes, maybe the joint procurement as such was, from the point of view of the, at least the first experience with the joint procurement of patents. I'm not talking about vaccines. I think from the point of view of the industry, it was rather received with mixed feelings. I think there it could have been done probably better. Now, for instance, one of the main issues there was that it appeared that some member states, they worked through the joint procurement, but apart from that, or in parallel with that, there was also the possibility to purchase as a member state on a direct basis some medicines. Of course, this is very disturbing, especially when you're in a crisis situation. So that created a lot of unrest. But of course, we can always learn from the lessons in the past. Now, coming back on this extremely interesting and important question, where to find the right balance. In my view, it's maybe I don't know whether it is different of you too, but I think that a medicines policy, you cannot consider it isolated on itself. I think medicines policy is finally, it's a part of a healthcare system. And so far, I think that healthcare systems are organized mainly on a national level, or in Belgium, you have the discussion maybe on a sub-national level, but it's, the center of gravity is a national level. So I think the core for the years to come will still remain there. Having said that, I think that indeed a European or a national or international cooperation and policies are important and will become even more important. And you cited that, for instance, when it comes to crisis situation. There's just one point I want to highlight here that has not yet been touched upon. I also think that Europe has a role to play in setting just the minimum standards for pricing and reimbursement systems. And here I want to refer to a directive that, in my view, has been pushed a bit into the background. That's the Transparency Directive. And I'll come back to one of the points I've been raising before, the urgent issue we have in Belgium with generics and biosimilars coming or being in the pipeline for managed entry agreements. The Transparency Directive says that each medicine, when it comes to the market, has to be able to call upon objective and verifiable criteria. Now, that's a real issue in Belgium insofar as the reference prices for medicines that are the subject of managed entry agreements. It's very technical but important in Belgium. Are confidential for all the good reasons. But that makes the business case for the generics and biosimilars when they come into the market very complex and to manage. So here I think this is something, a technical point, but an important point. We should look further at what Europe here can do even more.
Dr. Meiser, maybe you have a last word on this extra collaboration in Europe. Do you see added value there regarding supply or production?
Yeah, let me say, I think I have a very clear opinion. I think definitely Europe has a very strong role to play. And let me first touch base on two reasons which we have already touched a little bit before. I think on the one hand we say we need to have industry regulation. It needs to be coherent between the European Commission and the member states, and it should be also in alignment between the different countries. Yeah, I think this has been already discussed in several pieces. Yeah. Then I think the second point is, I think also on a European level we should come to a common alignment that for the moment in most countries it has been just price, price, price. I think we need to have on a European level a different thinking, say, instead of just focusing only on price, we need to value supply security. There is a price for it, it will cost some money, but I think we would need to be on a European level, we must be willing to say and have a strategy, yes, we are willing to pay this price. Now let me come to my main and key point, why I think we need Europe. If you just look now, it might be the COVID-19 vaccines or any other pharmaceutical product you have, if you look on the supply chains, they are so hugely complex. There's not even one country in Europe which has the ability to fulfill all the requirements. You can start from the raw materials based on crude oil basis, plant material basis, all the variant different stages of intermediates which you need. You need to have packaging minerals, you have classes, you have whatever. You need to have a very extremely complex supply chain, and everything needs to come together on a high pharmaceutical quality standard. So in my opinion, there is no country in Europe which has the capability to have all of these players, all of these production sites locally. And even, let's say, if we had it, I don't think it would be cost competitive, right? I think to produce such a complex product with a high standards for good reason and a high regulatory standards, we need to have a play together between all the different countries. On the one hand, on the European level, and I think also what we said, it's this open economy from Europe to the rest of the world. And even I don't think Europe in itself cannot have all of it locally, right? We need to come together and need to have a network, and only if you have a really good network, you can come to a final good, high quality, price competitive product. I think the question is more, how can we construct such a network that we have a resilient network and that we don't have, as soon as we have any small disturbance, that we have a supply shortage. For me, it's more a question, how can everybody play together within Europe and beyond to create a resilient supply network? So to answer it in short, yes, I think there is a very strong European role.
Work ahead, I would say, and that brings me to the final round for my panelists with a a short reaction. Fostering a sustainable climate for medicines in Belgium and Europe. What would be your takeaway message from the panel discussion today? Ms. Solomon.
Yeah, no, it's a bit, what I said before. I think that, in the actions that we have under the pharmaceutical strategy, we need to look in a holistic approach, to pharmaceutical policy, taking into account building on what we know in regulation, make it, optimizing it, working, in coherence with other policies and national policies as well.
Okay, Mr. Van Assen?
I would say stability. If I may summarize it in one word, stability. That's now what we definitely need for having a sustainable environment, at least in the Belgian context.
Okay, thank you. Mr. Van Damme?
Yeah, I think I completely agree with what has been said before. It's a multi-layered issue with several dimensions, and I think the moment is there to look at it holistically, as has been said before, and finally kick off this discussion on several levels.
Mm-hmm. Dr. Meiser, what's your takeaway message of today?
Yeah, I was very pleased to see that there's similar ideas between all the panelists, and we had, I think, similar thoughts how to do it. I think that's good. I think this gives me a lot of hope that we can do it. And for me now the question is really how do we implement it fast and efficiently? I think the ideas are good. I think now it's a question of implementation.
Well, that's maybe the topic of next year's webinar of the 3rd Generic Medicines Day, but I warmly want to thank all my panelists today for their contribution. And this brings me to the point that we will jump to the center of Brussels, where we await a reaction of Minister of Social Affairs and Health, Minister Frank van den Broeke. So we're very keen on his answer to this debate we had today.
Ladies and gentlemen, let me first of all thank Medaxes and congratulate the organizers and the participants of this interesting day on generic medicines. The presentations and previous debates obviously trigger many questions to which I would like to respond. However, at this very moment, we are working on what we call a pharmaceutical pact, that is a policy framework which we want to convene between, on the one hand, the pharmaceutical industry, on the other hand, the federal government, with participation of all the stakeholders involved. And since we're still working on that policy framework, and out of respect for all the stakeholders involved, I won't be able to go into any detail on the measures that we are contemplating today. However, there are several key points in the coalition agreement on which this federal government is based that are very much in line with today's themes, and that point, I believe so, to a clear direction. So allow me to elaborate a little bit further on these key points on which we are currently working. In our coalition agreement, a key word is an efficient drug policy. Obviously, that is a container concept. Efficiency means ensuring that medicines are used correctly, on the basis of scientific evidence, and this in a way that is financially sustainable from a budgetary perspective. The importance of the generic sector is obvious in this respect, both for patients and for our health insurance system. A healthy and competitive market is of prime importance to make our system of solidarity more sustainable. And to achieve this aim, the use of low-cost off-patent medicines will and must be further encouraged. With regard to prices of medicines, I'm fully aware of the importance of the sector's question to provide predictability and thus stability in the market. And obviously also from a payer perspective, from our perspective, a stable market with predictable prices, predictable budgets thus, is preferable. And I certainly agree that we must simplify the system where possible, because I believe that would be in everyone's advantage. I think there's common ground between you and me in this respect, and I'm confident that through a good agreement in this pharmaceutical pact, we will be able to find a way forward that is really in everybody's interest. I have several times heard today that pricing is not the only element. Supply security is key. Effective medicines that already have a certain lifespan appear in certain cases to have reached their bottom price in terms of profitability. On the other hand, of course, budgetary efforts, extra budgetary efforts will have to be made in the coming years, also in the off-patent segment of the medicines. That creates a tension. It does create a precarious situation for a number of medicines. And first and foremost, it is important to me that the patient can maintain a sustainable access to these medicines. And also, the companies concerned must be able to count on a stable operating framework. It's therefore important that all those concerned find appropriate solutions to this problem, this tension that we live with in the ongoing pharmaceutical pact negotiations. Many questions also revolve around the role of Europe, which is very important to me. I'm a very strong supporter of broad international cooperation for pharmaceutical policy, both in the scientific field regarding HTA, as well as in the field of distribution, but also strategic choices for production. During the COVID crisis, it has become very clear that Europe has a crucial role to play. It is important to maximally coordinate internationally and national policies during the entire life cycle of a medicine. A holistic approach based on constructive cooperation is without doubt the way to go. Our country must look beyond our national borders. We must respond to an evolving European but also global context. A number of European and international initiatives in which Belgium participates and actively contributes have been launched. HERA, the new Health Emergency Preparedness and Response Authority, and the IPCAI, the Important Projects of Common European Interest, are but two examples, but key examples. The coming months and years will be crucial for Belgium to optimally play its role at the national, European and global level. And in this spirit, I would like to end thanking you again for the opportunity to speak to you and wishing you much success in all your endeavors. Thank you.
With these closing remarks by Minister Van den Broeke, we've reached the end of our second Generic Medicines Day. Leaves me to thank all contributors to this day and certainly the people joining the panel and giving the introductions. Let me remind you that you can still send in questions via the chat function to the Medaxes team on the topics addressed in this webinar. We are curious to find out what will be the common ground, as the Minister said, for the pharmaceutical pact that we hopefully can close soon, and then we can build on these ideas further and maybe already towards the third Generic Medicines Day next year. It leaves me to already invite you to our third Generic Medicines Day next year. Hope to see you then.